I'm Dr. Grant Simons. I'm Chief of Heart Rhythm Services at Englewood Health. My specialty is cardiac electrophysiology. I'm a cardiac electrophysiologist, and what that is a cardiologist with additional training in heart rhythm disorders. And heart rhythm disorders are basically electrical problems. So we're sort of the electricians of the heart.
Dr. Simons?
Yeah.
Hi, this is a patient that's coming in next week and he wants you to review his results.
Okay, very good. I'll take a look at it. Thanks a lot.
You're very welcome.
The reason I became a physician was when I was about 6 years old, we were sitting in a restaurant and I announced that I wanted to be a mechanical engineer just like my father. And my father said, no, you want to be a doctor. And he told me why I should be a doctor. And he said, because being a doctor, you get to use science and you get to help people. And I was 6, 7 years old, whatever I was, and I said, okay. And from that day on, I was going to be a doctor. Well, as it turns out, I turned out to really like being a doctor. I liked learning about medicine and being a medical student and a resident because I loved science. We can insert this device through a catheter, and then we take the catheter out and leave this behind. But as my career progressed, and I went from being a resident to being a fellow to now being an attending physician after a few decades, it is because I help people. And I really do love what I do because I can establish a relationship with patients where I can deliver a product to them, this care that is very advanced and wondrous, but at the same time human. And they're happy when they don't have palpitations anymore, they're not dizzy anymore, they don't pass out anymore. Reduce their risk of sudden death. Let them get off a blood thinner without worrying every day about a stroke. So for me, what my father told me at the beginning actually was all true. I grew up in this community and went to high school nearby. Englewood was always my family's hospital and my hospital. In fact, when I was a little kid and I fell off my skateboard and broke my arm, I came to the emergency room at Englewood Hospital to have it set. And then I went off to get educated and trained, and I had a job for a few years in Washington, D.C. But eventually I was able to come back to my own community to practice advanced electrophysiology, and that's very rewarding for me.